Okay, for the management, you're going to be considering right-sided and left-sided heart failure at the same time because the management options are similar. Let's break it down into two. We have the pharmacological management and the non-pharmacological management. So talk about the non-pharmacological management first before we go into the pharmacological management. Because in nursing, medications are usually administered when other non-pharmacological management fail to solve the problem or they are not enough to solve the problem. So that will make us look at non-pharmacological management first. Now let's look at the types of non-pharmacological management. So we have the first one, which is identify the underlying cause. Now there are many things that could cause heart failure in a patient. You have things like hypertension, cardiomyopathy, myocardial infarction, and all that. So you have to look into those things first, identify the root cause before you can now go further into the treatment. The second option there is lifestyle modification. You can place this patient on a low sodium diet and there should be fluid restriction. Remember, in heart failure, the body is trying to deal with fluid, so there should be fluid restriction. You also want to place this patient on mild exercise as much as the heart can tolerate. You don't want to give the patient rigorous exercise because it will complicate the symptoms. So now let's look at the pharmacological management of heart failure. We have diuretics. I'll say this again. In heart failure, there is a problem with fluids. The right-sided heart failure, the problem is in the right ventricle, and then there's peripheral edema. While in the left-sided heart failure, the problem is in the left ventricle and there's pulmonary congestion. So all these have to do with fluid. So diuretics will come handy in management of heart failure. Look at diuretics like furosemide. We have to reduce the fluid load on the heart, thereby improving the outcome of heart failure. We also have another group of drugs that can be used in the management of heart failure, and these are the ACE inhibitors, also known as angiotensin conversion enzyme inhibitors. What these drugs do is to cause vasodilation, and when there is vasodilation, it's going to reduce the blood pressure, thereby reducing the load on the heart. So it's going to help you to manage the symptoms of heart failure. Let me know in the comment section if you want to learn more about ACE inhibitors. Now, let's go back to the other type of drugs that are used in the management of heart failure. We have the beta blockers. These beta blockers reduce the force of contraction on the heart, thereby reducing blood pressure and the overall workload of the heart. And in this category, we have drugs like metoprolol, labetalol, carvedilol, and so on and so forth. Let me know in the comment section if there's any topic you want me to talk about. And until then, do well to follow me so you don't miss out on any of my updates.